I'm Dr Derman, Orthopedic Spine Surgeon at Texas Back Institute.
Yeah.
Well, I grew up in Dallas in the Preston Hollow neighborhood. My parents still live here. Afterwards, I moved to California. I went to Stanford for undergrad, and I was actually a gymnast all the way through college. And afterwards, I moved to the West Coast. I did my training, medical school at Penn, and then hospital for special surgery for residency. Then I moved over to Chicago, where I did my fellowship, and I'm excited to be back here as a spine surgeon. So I started gymnastics when I was 5 here in Dallas. So it's been kind of a long-term thing. It's all I ever really knew. So I did that all the way through elementary school, middle school, high school, and then I was the captain of the team in my college as well. I thought about continuing on in gymnastics, but I knew that I had a passion for medicine, and I would have had to put my career on hold. So ultimately, it was a decision that I made that I would stop gymnastics and move on with medical training. So I figured out pretty early in my college career that medicine is where I wanted to spend my life. I've always been interested in biology and also kind of physics and building things. And I shadowed a surgeon and was really impressed by the kind of impact, the one-on-one impact you can have on a patient through medicine and especially through surgery. And when you see someone and you look at them and you see how they're suffering, and you can empathize with that person, and you don't want them to be going through that, and to be able to form a relationship with them and then help them through that and then see them through that is something that I really can't compare to anything else. I decided to come back to the North Texas area and specifically the Texas Back Institute. One, because this area is my home. I have family here. I have a young son, so it's nice having that social network and family around. But specifically this practice, I think, is a special one. There's not many places like this. The Texas Back Institute is well known nationwide and even worldwide. And it's for a number of reasons which are all important to me. So first of all, clinical excellence is the number one thing and should be anywhere. But Texas Back Institute can also back that up with the education, so there's a fellowship which I'm passionate about, as well as research and academics, which really puts us in the forefront globally, nationally, and into the future. My favorite hobby right now is bringing my son to the aquarium. We like to exercise, ride bikes. My wife and I brew beer, which is a big part of our kind of hobbies and things like that. We've been doing that for quite some time as well. Something a little bit unique about me is my training specifically in minimally invasive techniques. My fellowship was heavily influenced by these. So this means smaller incisions, less muscle damage, and hopefully getting patients out of the hospital as quickly as possible, even doing as much outpatient spine surgery as I can. Now, these techniques aren't specifically applicable to every patient and every problem, but it's kind of a philosophy that I bring to the table whenever I look at a patient who has a surgical issue. Professionally, I'd like to be known first and foremost as a good surgeon and a good clinician, someone who takes care of their patients, who puts their patients first, because ultimately if that's not what you're doing, then this isn't the right profession for you. Besides that though, I am very passionate about teaching, and so having fellows and teaching the next generation of spine surgeons is something that I find fun and rewarding.